as someone who worked hard building a state system that tries to cover everybody with affordable health care. And we've been able to celebrate milestone after milestone of getting better and better over the last 10, 15 years. This really takes us backward. And I think is going to affect everybody in the state, regardless of whether you're insured or if you're on Medicaid or in the marketplace. It's going to have an effect on everybody.
Hi, everybody. Thanks for watching Policy for the People. I am Juan Carlos Ordonez. Today, we're going to be discussing the past, present, and future of our system of healthcare here in Oregon, including what the enactment of the massive federal reconciliation budget bill, the so-called One Big Beautiful Bill, means for our healthcare system here in Oregon. And to discuss all of this, I am joined by Dr. Bruce Goldberg. Bruce is a professor at the OHSU School of Public Health, the OHSU-PSU School of Public Health, and a nationally recognized health policy expert. Among his many accomplishments, Bruce was the founding director of the Oregon Health Authority. He has also served as director of the Oregon Department of Human Services. And I should add that Bruce also serves on the board of directors of the Oregon Center for Public Policy, which produces this show. So, Bruce, how are you?
I'm good. Great to be here, Juan Carlos.
So I want to start by going back just a few years to 2022. And that year, Oregonians put into the state constitution the following language. It is the obligation of the state to ensure that every resident of Oregon has access to cost-effective, clinically appropriate, and affordable healthcare as a fundamental right. I'm wondering how close or how far are we from fulfilling that obligation of ensuring that everybody has access to affordable healthcare that is clinically appropriate?
It's a great question. That bill that was really the impetus from Dr. Mitch Greenlick, Representative Mitch Greenlick, who fought many years to get that to happen. We're not there yet by any means. In fact, we'll talk about this. We've taken some steps forward, but recently we're now taking a few steps backwards. Not everybody in our state has affordable health care that meets their needs, and that's something we need to keep working at.
So if we go back farther still, 15 years ago, Congress enacted the Affordable Care Act, which was at the time one of the biggest changes to our system of healthcare here in our country. And I'm wondering, what were the main changes that the Affordable Care enacted, and to what extent did it improve the healthcare system for Oregonians?
Well, the Affordable Care Act was an amazing advance, both for our state as well as for the country, and it did a couple of things. One, it greatly reformed our health insurance market. People, I think, forget this now, but it used to be that you could be excluded from health insurance if you were sick. And health insurance didn't cover certain pre-existing conditions. All that went away. Now, insurers had to issue you a health plan. They couldn't say, well, we'll cover you, but you have diabetes, so we'll cover you for everything except the thing that you need health insurance for. So it was just a huge change. So one was just guaranteed issue. Two was it created an essential benefit that all health insurance needed to cover. So that was great. It banned lifetime limits on healthcare coverage, and it had some preventive care at no cost. So there were some great insurance market reforms. And then there were some really great things to help people get access to health care. More people got health insurance because of the Affordable Care Act. And it did two big things. It expanded Medicaid so that now Medicaid could cover people up to 138% of poverty. And it also created the insurance marketplace, where people could get above 138% of poverty, could buy health insurance, and they could get some premium tax credits and cost sharing help. So it really helped get people more health care. Here in Oregon, we added over 200,000 people to the Oregon Health Plan. We saw the number of people who were covered by health insurance go up from, the low 90th percentile to up about 95, 96%. So all of that, great. But this gets to the point you raised, Juan Carlos, about where are we in terms of getting everyone affordable health care. We still have a problem, and that problem is that healthcare is too expensive and that many people have high deductible plans. And, 2/3 of people who are bankrupt cite medical bills as the primary cause. 20 million adults owe healthcare debt. 3 million adults in the country owe over $10,000. And because of that, people delay getting care, or they don't get care because they're afraid they're going to owe. And that's because we've got a lot of high deductible plans that cost people, the deductible is $3, $4, $5, $7,000 a year, which for low income families is not affordable. So we're a long way from reaching what Representative Greenlick thought we needed, which was where everybody in the state has affordable health care. We've got people who have some health care coverage. And certainly now we have 97% of people in the state have health insurance coverage, but for a lot of people, it's not adequate. And even with health care coverage, they go bankrupt.
I wonder if you have a sense of who it is that remains outside of coverage, what population still tends to lack health insurance, and also what population tends to suffer the most in terms of this issue of medical debt and struggling with the affordability of healthcare.
Minority and low-income communities are disproportionately affected, both by medical debt as well as those are the populations that have the highest rates of uninsurance. So that's one big piece of those who are uninsured. There's a group of people who choose to be uninsured. They don't sign up, et cetera. And those are the big groups.
Mm-hmm. Some of the reforms in the Affordable Care Act were optional for states. For example, states could choose whether or not to expand Medicaid coverage in their states. How well did Oregon do in terms of maximizing the benefits of the Affordable Care Act? And also, how are we in terms of, compared to other states, in terms of making healthcare access, expanding healthcare access?
So what the Affordable Care Act did was, initially um, the bill mandated that all states would expand Medicaid and up to 138% of poverty. It turned out there was a court case about that, and that was no longer a mandate, and it became an option. About 38 states took up that option. Still a number of states who don't. Oregon obviously took up that option, and we cover people up to 138% of poverty in our Medicaid program. And we did an incredible job in outreach. It isn't just saying on paper that you cover people. It's really getting the word out. It's having application assisters. It's creating applications that are easy. There's a lot that goes into getting people covered. And Oregon is in the top tier of states in getting people covered. And recently, we've gone beyond simply getting people on Medicaid. We've created healthcare coverage for people who are not citizens who wouldn't qualify for Medicaid based on not being citizens, and we now cover them through a number of programs for kids and adults. So we really lead the nation in covering people in our healthcare system.
So the Affordable Care Act fell short of ensuring that everybody has access to clinically appropriate, affordable health care. What structural factors made the Affordable Care Act fall short? What was it that made it insufficient?
Well, I think a couple of things. I mean, it went a long way, and it's been a great thing, and I think uh, we can't underestimate that at all. The hundreds of thousands of people in Oregon that have benefited from the Affordable Care Act has been just remarkable. Um, but putting that aside for a moment, I think where it fell short was in a couple of areas. I think the insurance marketplace, creating the high deductible plans, that clearly is a place where we could see some improvement. And obviously, the other place where the Affordable Care Act didn't do enough, but we've taken on that task here in Oregon and has done very well, was covering individuals who would otherwise qualify for Medicaid except for citizenship. It's another place where the Affordable Care Act fell short. The other place that we fell short was uh, in our small group market and how we could create an affordable small group market. We still have many people that work for small businesses. Small businesses, many of them can't afford to cover their workers, and that's another place that we need to and could do better.
You mentioned the issue of medical debt earlier, how it remains a big problem. Has that problem been growing in recent years? Or has it remained stable and has been a persistent problem? How would you characterize it?
No, it's been growing, and it's been growing because what's been happening in our healthcare system is that because healthcare is so expensive, um, some of those costs are being shifted to consumers. And we've seen an incredible increase in the cost shifting to consumers. We've seen more and more high deductible plans. We've seen more and more copays and coinsurance. So more of the cost of health insurance has been shifted to consumers, and that's led to more and more bankruptcy. Again, the amazing statistic is not only are two-thirds of personal bankruptcies in the country due to medical bills, but most of those people are insured. So we have people who have health insurance who are going bankrupt, declaring personal bankruptcy because of medical bills. They're losing assets like their homes, they've got damaged credit. It's a real problem, and it's really increasing. And it's something we need to pay a lot of attention to.
Shifting gears here, in July, just very recently, the Congress passed by the narrowest margin a massive budget reconciliation bill known as the One Big Beautiful Bill. And the bill really amounts to a massive set of tax cuts that mainly flow to the most well off, paired with cuts to healthcare and nutrition assistance. Can you walk us through the main changes that the reconciliation bill makes to our system of healthcare?
Yeah, it's really, we started, you spoke about starting with the Affordable Care Act and the Oregon constitutional amendment, all these things moving us forward in terms of covering people, getting them affordable health care. Unfortunately, this reconciliation bill takes us a step backwards. And it does that in a number of ways. The first thing is in state Medicaid financing. Um, Not to get into the details, but we use, as many states do, a provider tax to help us pay for our Medicaid program. And what the reconciliation bill does is it dials back the ability of states to use a provider tax. Where we've up until now been able to tax 6% of a hospital or health provider's gross receipts. That's being ratcheted down to 3.5% over a series of years. Without getting into all the gory details, what that does is that the state is going to lose $870 million in federal funds in the 2027-2029 biennium. It's going to lose $11 billion over 10 years. So what that means is that we're going to see less federal money coming to the state for healthcare, for Medicaid, and we're going to have to find that money somewhere. And that means either raising taxes, less money for schools, public safety. It's going to create a huge budget problem for the state. So, number one, this really decreases federal support for Medicaid. In its simplest way, that's a big thing. We're going to lose $11 billion of federal money over 10 years. The other thing it does is it makes a variety of changes to how the Medicaid program works, which, to cut to the chase, really will have the effect of several 100,000 people losing coverage here in Oregon. What those changes are number one, starting in December of next year, 2026, there's going to be work requirements for several 100,000 people on Medicaid. They'll need to demonstrate that they have 80 hours of work or some other qualified public service or other activity. What we've seen in other states that have instituted work requirements in the past is that, in essence, it keeps people from signing up for Medicaid because it creates a lot of bureaucratic hoops for them to jump through. It doesn't increase employment, and it decreases people getting health care. So that's one issue. The second issue is people now will need to reapply for Medicaid every 6 months. Right now, adults reapply every 2 years here in Oregon. And what re-enrolling every 6 months means is that people will fall off the health plan because, unfortunately, signing up for Medicaid is often difficult. People have a hard time understanding the application. They don't get notices. They don't have permanent addresses. They're migratory. For a host of factors, many people will fall off of Medicaid. They'll lose coverage, and the state will lose federal support for Medicaid, over $1 billion a year. The bill will also require cost sharing for some people, low income people, $35 a service for some adults. So those are the big changes to Medicaid that will, in essence, will lose billions of dollars of federal support, and several 100,000 people will fall off of Medicaid, which will mean more uncompensated care, more people coming to the hospital and to the doctor uninsured. That means that the costs of that will be shifted onto the rest of us. It will create a terrible cycle. And then the last piece is the marketplace. that we talked about earlier, where people who are working above poverty can buy health insurance and get premium credit. The premium subsidies are going to, some certain premium subsidies are going away. That means certain people will pay an average of almost $1,000 a year more for health care. What that will do is it will push healthy people out of the insurance market. Many people will make an economic decision. I'm healthy. I don't need health insurance. I can't afford to pay another $1,000 a year. So I won't go, I'll go without health insurance. What that means is that the pool of people in that market will now be a pool of very sick people who need to pay that money because they have a lot of healthcare expense. That will boost the cost of a health insurance premium. So we're just going to see a huge cycle of more people uninsured. That will create to rising healthcare costs. We're going to lose federal support. It just takes us backward, and it's really, really sad. As someone who worked hard building a state system that tries to cover everybody with affordable health care, and we've been able to celebrate milestone after milestone of getting better and better over the last 10, 15 years. This really takes us backward, and I think is going to affect everybody in the state, regardless of whether you're insured or if you're on Medicaid or in the marketplace. It's going to have an effect on everybody.
As you said, Oregon is going to take a big hit financially in terms of the federal support it receives for health coverage in the state. Can Oregon maintain the existing level of health coverage? What would it take to ensure that Oregonians don't lose access to healthcare? Is there a way to accomplish that?
Well, I think this is what a lot of us are thinking about, working on right now is, losing $1 billion in a biennium. Uh, how do you make up for that? And, I think that we can do some things to help make the Medicaid system more cost effective. We can streamline Medicaid. I think there are some things that we can do, but I think it's going to be really hard. And I think that it will still mean that a lot of people are going to lose healthcare coverage.
So, for several years now, the state of Oregon has been working on developing a plan for universal health coverage. And in fact, the legislature created the Universal Health Plan Governance Board, which is tasked with developing a plan for how to finance and how to run a universal health plan. And you are a member of that board that is developing the plan. I'm wondering, given what the damage that the reconciliation bill does to our system of healthcare, is there still a path there for Oregon to reach universal healthcare?
I believe there is. I believe that eventually we will create a system where everybody in the state gets the health care that they need, and where we have a healthcare system that's affordable. This bill, it both sets us back because it creates more people who will lose coverage. On the other hand, I think it shines a light on the problems with our healthcare system and demonstrates the need for a more affordable system. I've just seen our healthcare system get so much more complex and complicated. And I think we're reaching a point where everybody is starting to realize that we need to have a simpler system that covers everybody, that we get notices of coverage that none of us understand from our health insurers. We have doctors and hospitals and health insurers that have offices chock full of people doing prior authorization and administrative functions that add very little value to our healthcare system. I just think we're getting to the point where I think more and more of us are realizing that our system's broken and we need to change it. So, in a certain way, the reconciliation bill puts us a step back. In another way, it highlights the need for a simpler, cost-effective system that covers everybody. So, I think there's many more chapters to be written in this book.
For Oregonians who yearn to see a system where everybody has access to affordable, quality healthcare, what actions can they take? Do you have any words of wisdom to share with them?
Yeah, I think people can get informed about our healthcare system and the changes that are necessary. I think that they can follow the Universal Healthcare Governance Board. I think they can talk to their legislators. I think they need to get involved in the political process that has people working towards healthcare for all. So I think that I think people need to get involved in the political process in the state.
And perhaps the recent changes, massive cuts enacted, will galvanize some of that support.
I think that's the hope. I mean, I think that's perhaps maybe a little bit of the silver lining.
Well, Dr. Bruce Goldberg, thank you so much.
Juan Carlos, a pleasure. I look forward to more conversations.